Good afternoon, everyone. Thank you for coming to this event this afternoon. This is Come As You Are, a support space for women. This presentation explores how to support women navigating the emotional, physical, and relational impacts of a cancer diagnosis and how that diagnosis does not define you. Baliegh will address changes in identity, body image, and intimacy while offering practical, compassionate tools to foster connection, communication, and self-trust throughout the journey and afterwards. I'd like to introduce our speaker, Baliegh Butler. She is a founder of Balance Bliss Therapy, a private practice based in the North Hills of Pittsburgh. She is a licensed clinical social worker and a certified sex therapist who specializes in supporting individuals and couples navigating intimacy, relationships, and life transitions, including those impacted by cancer. Baliegh takes a holistic, trauma-informed approach to care, integrating mind and body practices to help clients connect with themselves and their partners. She has a special interest in working with individuals and couples facing the emotional and physical changes that can come with a cancer diagnosis and treatment, including changes in intimacy, body image, and communication. In addition to psychotherapy, Baliegh is a certified end-of-life doula and Reiki master, allowing her to support clients across the full continuum of care with compassion, education, and practical tools. She is passionate about creating safe, approachable spaces to have conversations that are often avoided but deeply needed. Thank you, Baliegh, for joining us today.
Thanks for having me, everybody. So the presentation, Come As You Are. So hopefully it's engaging, interesting, and all of the things that you're hoping for today. A little bit more about me, like where I got my education. I am an ASECT certified sex therapist, so it's additional supervision for 2 years past the program that University of Michigan offers for certified sex therapists. And then, Wexford is where my office is. I also do virtuals. All right, so this presentation, you can participate as much or as little as you would like. I want this to be an emotional safety space. No one has to disclose their diagnosis, relationship status, sexual concerns, or anything personal if you do not wish to do so. So cancer does not define you. I hope that you know that by now. You are a person who has experienced cancer or are experiencing cancer, but you are not cancer. A diagnosis can suddenly become the first thing everyone asks about, but there is still an entire person underneath that diagnosis. And so I'm hoping today you'll take that with you and learn how to be who you are without the diagnosis attached. So when I think about having conversations with people who do have a diagnosis or have lived through a diagnosis, who were you before cancer? So some people might say, for this women-specific presentation, a woman, a partner, a friend, a mother, professional, sister, creative, adventurer, caregiver, etc. But I want you to think about 3 things, 3 words you would have to use to describe yourself before your diagnosis. And if anyone would like to share, they can, but you don't have to, I understand. It's interesting to try to think of, depending on how long ago your diagnosis was, what you may have thought then versus maybe what you're thinking right now, right?
Are our mics on?
Yeah, I can hear you.
Oh, okay. So how about curious
Yeah,
and happy
yeah,
and independent?
okay. Yeah, yeah, all of those things. Thank you for sharing.
Sure.
And then I think about when cancer decided to enter the room, right? And how that might have felt. So we have our diagnosis, which means appointments, treatment, scans, side effects, and probably a lot of decisions. And so you think about how that felt when that time came. When everyone sees the patient, right? They're asking, how are you feeling? How is treatment? When is your next scan? But do you feel like during that time, people were asking about you or your cancer diagnosis, right? I'm sure conversations became different with different people. And so I want people to go back to when they're having conversations with somebody, feeling encouraged to say, I'd rather not talk about those things right now. I'd rather talk about what am I up to today? Or when's my next shopping that I can go do? Or when can I get a massage? Right? I want people to feel like they can intercept the conversation and saying, I'd rather not talk about that right now. I'd like to talk about X, Y, and Z, something else. Because sometimes people get caught up in all of these questions and seeing that person as a patient instead of somebody who has lived experiences. So part 2 of this, the things that women may not say out loud. Not every woman, but some. So obviously there's no one right way to feel. We might feel relief, anger, gratitude, fear, sadness, numbness, hope, and frustration, but normalizing emotional contradictions. So we could be feeling any feelings at any given time, and they could change 5 minutes later. So I want people to know that it's okay that your emotions are up and down, right? Cancer is a very big word. It means a lot of things to somebody. And so I want people, and I encourage people in practice, it's okay to express how you're feeling. There's no right way to feel during this time. And you might feel all of these things or none of these things at any given time. And that's okay. So should I be grateful, right? We're addressing pressure to remain positive. Gratitude and grief can exist simultaneously. And a woman can be thankful for treatment and still hate what treatment has done to her body or her life in general. So I think that there's misconceptions of how people should feel or should act. And so I encourage people to say how they're feeling, not just like I'm thankful for treatment and that's it. But I want people to go back and forth of like, hey, I am so thankful to be here, and this is what I'm going through. But I also don't like this part, right? And that's okay to not like part of the treatment, the scans, the appointments, all of those things. I think that people get into, I have to remain positive for everybody else. But what happens when I'm not feeling that? And so I encourage people to talk to their loved ones and their providers about how they're feeling regularly, instead of just pushing through. I've heard clients say, I'm just pushing through to get to the end, and that's all I'm focused on. But I want people to be able to express themselves so that they're not holding it in, and that their loved ones and healthcare professionals know what they're feeling and thinking. You may have questions that maybe you don't want to ask. So seeking out somebody to ask them maybe for you, advocate for you. But also, how do I ask that question if I'm not comfortable asking what I'm thinking or feeling? All right, the losses that nobody else may see. So when I think about clients who have cancer diagnosis, these are some of the things that they've told me. They've maybe lost their confidence, their predictability, their independence, fertility issues, their sexuality, energy, career momentum, friendships, body familiarity, and future assumptions. So when you think about your diagnosis, do any of these resonate with you? Or what are some other things that maybe you're thinking of, like that maybe aren't on the list, right? These are from clients specifically on, my tracker of what people have expressed to me. So I'm sure there's a lot of other losses out there that people have experienced themselves. And I tell people, it's okay to journal about these things, to get it out there, right? So that you're not the only one holding it in. You're talking about it. Cancer doesn't always wait until you're retired and you've had your whole career. Sometimes, the youngest person that I've had was 17, and she didn't even get to start a career. So I think about all of the things that she expressed in terms of loss, for somebody that young. And I mean, the oldest person that I've had as a client that has experienced cancer was 82. So, that's a big age gap and their losses are very different. And so I think, we don't always sit down and think about those things. But sometimes that's okay to do so. So you may feel some of these things, that you may feel as though your body has become a medical space, and you may have not, right? Some people have expressed this. So with the amount of exams, procedures, maybe port placement, just new scars, surgeries, medications, strangers touching your body, this all can affect ownership and connection to your body. Maybe you just don't feel like you recognize who you are in the mirror. And so that really can affect somebody's overall perception of who they are and who they've become since that cancer diagnosis. And so I work a lot with clients in maintaining like who I am as a person and what my body means to me. And so we talk a lot about that as well. And so when you look in the mirror, something that maybe you've noticed, or maybe your hair changes, those scars, weight changes, breast changes, swelling and inflammation, changes in your skin, maybe an ostomy, surgical changes. And so the focus on adjustment rather than loving your body overall can be impactful for people. We want to figure out how we can look in the mirror and just see us instead of all of these changes that we've experienced with our diagnosis and what came with that. Takes sometimes a lot of work. I have people, put those sticky notes of self-affirmation on mirrors, or places that they look a lot at themselves, in the car, in the mirror, because I want people to remember they are a loving being. And all of these changes, you may not have experienced all of them, but maybe some of them. And so people really do get down on themselves. And so we encourage people to self-affirmate positively multiple times a day. We journal. We do things that we really like to do, that we're able to do. And if we feel like we can't do things that we used to do the way that we used to do them, we find new things. And so this is something that I work with clients on as well. So you don't have to love your body today, right? We can like our body today and not tomorrow, right? So we always want to make sure that we're checking in with ourselves. I tell people not to ignore your thoughts and feelings and to check in with yourself regularly, do a little check. And so if we're not able to do that, maybe we ask somebody that we trust and love to check in on us. And so somebody's holding us accountable, somebody who maybe didn't love their body before cancer's diagnosis, it would be even more challenging after. And so we try to figure out a way to like our bodies. Doesn't have to be positive 100% of the time, but we try our best to get to a place where we're comfortable. Part 3, rebuilding trust with yourself. So when your body doesn't feel like yours anymore, we explore the disconnect between before cancer and after cancer. Oftentimes clients will say, oh, well, before cancer, this is what I felt like, this is what I look like. And after, this is, what I'm dealing with. And so I try to help people figure out similarities in those, and what people are really challenged with after a cancer diagnosis. Sometimes we would ask ourselves, what would feeling like yourself again actually mean to you? And so that's a really good question to ask yourself regularly, because today might be a different answer than yesterday or tomorrow. It just depends. I think everybody is different in how they view themselves. So I think that this is important to be able to distinguish how you're actually feeling and what it would actually mean to feel like yourself again. Sometimes it takes a little bit of digging to find those answers. Trusting your body again. So cancer can create hyper awareness. And so is that pain normal? What if it comes back? We talk about rebuilding trust without dismissing legitimate medical concerns. So this doesn't happen overnight. This sometimes takes a long time. People do have scan anxiety. We call it in therapy is, I know when I make that appointment, I think of worst case scenario. So we try to figure out a different way to approach those appointments, and scans and procedures and things like that. And this takes time, right? So I think that the whole journey takes a lot out of somebody. It takes a lot of convincing ourselves. And why does it take time to do that? Because we're average people, right? Nobody is perfect. So who am I now? Rather than getting back to normal, people say, we discuss integrating the experience into identity. So maybe the goal isn't becoming your old self. So remember when we asked in the beginning, what are those 3 words that you described yourself as before the cancer diagnosis? What 3 words would you like to describe this next version of yourself? And so that's something that you can think about if you haven't. And any answer is good, right? There's no right answer. So I think that it's important to know that you're still a human being and you're still going to do things that you love to do. And that's important. So what do I want to keep from before cancer? What do I want to change? What do I want to reclaim? And what do I want to release? So this could be a very powerful journal writing prompt for people. And so you can write as much or as little, obviously, as you would like. But I think oftentimes people feel a lot of empowerment from something like this. So, in your time, maybe come back to this and think about what these answers would be if somebody were to ask you those questions. I think that you would find a lot out about yourself. Sometimes we talk about giving ourselves a permission slip, because we don't always have to be that 100% positive, focused person. Sometimes I can give myself permission to rest, to say no, ask for help. That one's hard. Change my mind, right? We talked about every 5 minutes we can change your mind. That's okay. Grieve, have fun, not have to explain myself, want intimacy or not want intimacy. So I think giving ourselves permission to do these things can feel like oh my gosh, I didn't even think about doing that. But really, it's okay, right? You're not going to be 100% all of the time. And so when we do feel good, maybe we do want to have fun. Maybe we do want to spend some time grieving. Um, you don't always have to be the yes person. So saying no is okay. Part 4, relationships after diagnosis. So cancer changes relationships too, not just the individual themselves. So changes in partner dynamics, friendships, family roles, our caregiver, our independence, and expectations may change within all of those uh, items. And so if you take a minute to kind of think about what relationships changed with that cancer diagnosis, what maybe like the first 3 that come to mind or 2. And sometimes during cancer, your partner becomes a caregiver for you. So the romantic relationship can unintentionally become patient versus patient and caregiver. And both people may struggle to switch out of those roles whenever it's not needed to be patient caregiver anymore. Um, and I think this affects a lot of times that intimacy part. Um, both can be very exhausting. And so I think open communication when it comes to this type of role is very important for people. Some folks have said, I don't want to burden them. But so women may minimize fear, discomfort, sexual concerns, or emotional needs to protect others. And silence can unintentionally create distance sometimes. So I do encourage people a lot to communicate. Even though it may be uncomfortable, I think communication is very important, not only in my, romantic relationships that people have, but also in that healthcare relationship that you have with your providers as well. Sometimes people are more comfortable talking to the nurse versus the physician or the surgeon. And so I encourage any discussion to be had. I tell people to think about, what do I actually need, right? I need people to listen to me, help me, reassure me, and give me space, right? So that seems a little counterintuitive of like, oh, I need space, but I also need help and reassurance. And so I tell people in these categories to write things in their journal of, what does that mean to listen to me? What does that mean to help me, reassure me, and also give me space? So advocating for what you need is very important. And if you need somebody to help you with that, that can be difficult, right? So I tell people, find that trusted person that I would want to ask to help me do these things. Some women that I have seen, I don't need you to fix this. Can you just sit with me? I want tonight to be a cancer-free conversation. I need help, but I want to choose how. So I tell people, these are uncomfortable things to say to somebody sometimes. And so writing them out is helpful. Practicing asking certain things. Maybe you're a person that never asked for help or never wanted somebody to fix things or just be with you and sit in silence. That can be a very impactful thing to do. So I tell people to rehearse what they want to ask, and that's okay. Can feel awkward, I'm sure. All right, part 5, intimacy. Let's talk about it. So intimacy is bigger than just sex, right? Emotional closeness, affection, touch, vulnerability, companionship, playfulness, feeling desired, feeling understood, and sexual connection can all be under that word intimacy, right? And so some of the ways that cancer can change sexual health, desire, arousal, lubrication, orgasms, pain, fatigue, hormonal changes, sensation, confidence, and fear. So these are all legitimate healthcare concerns for somebody to have. These are all very normal. So I tell people, if you're starting to, or if you have been feeling any of these things, I tell people to really talk to their providers about ways. I don't want to give medical information on this, so I do tell people to reach out to their providers, or look at holistic ways to increase feeling and relief, pain, and things like that. So I do encourage that, as I am not a medical provider. So if you're feeling these things and you're willing to have that conversation, I tell people to have that conversation. And in therapy, we talk about ways to have that intimacy if you are experiencing any of these. Again, intimacy does not have to be penetration. It can be anything on this list. And so we talk in therapy about. Some people may ask, do they still find me attractive about their partners? So people experience body image and desirability concerns. The partner may have potential fear of initiating because they don't want to hurt or pressure the person with cancer. But these are all very normal conversations to have with our partners and our healthcare providers. So I tell people when a diagnosis has came about to start having those conversations ahead of time. If we just don't address the elephant in the room with our partner or healthcare provider, they may not feel like they can do that either. So conversation is definitely my number one topic for people. And sometimes we take sex off the table, right? It's okay. We can get back to it, but some pressure-free connections that I recommend to people that are experiencing some of those things that I mentioned, the pain, fear, lubrication, things of that nature. Holding hands, cuddling. A lot of people who are married end up not doing these things anyway. So it's kind of like, let's go back to the basics. So massage, lying together, kissing, affectionate touch, that the touch doesn't lead anywhere. So these are sometimes pressure-free connections that can make somebody comfortable in that moment. But again, having these conversations with people. So the intimacy ladder. So conversation, proximity, affectionate touch, sensational touch, sexual touch, intercourse, or other sexual activity. So a lot of times people have never brought toys into the bedroom. And so sometimes that is not needed or necessary, but it is something that could be introduced if penetration is not an option because of that pain or fear or lubrication, XYZ, you name it, the fill in the blank. So I think that sometimes people are afraid to talk about bringing toys or introducing toys. But I think that that's a conversation that you and your partner have to have. And so that is an option for people at times. And part 6, life beyond cancer. So survivorship can be complicated. Everyone may expect a celebration when treatment ends, while women sometimes still experience anxiety, grief, scan fear, loss of medical support, uncertainty, or difficulty returning to quote unquote normal. So I think that you telling people how you're feeling ongoing is definitely an important part of your journey. You are allowed to want more than survival. So joy, pleasure, connection, rest, purpose, sex, adventure, peace, or fun are just some things that somebody could want. But can you think of things that you want that maybe aren't listed here? And so I think that that's something that people can also journal about to figure out more of what they want. So come as you are. You don't have to become who you were before cancer. You get to discover who you are now. And so that can be empowering for some people. I tell people you don't have to be inspirational. You don't have to be positive every single day. You don't have to love your changed body. You don't have to return to the person you were before. You don't have to talk about anything you're not ready to talk about. You get to come as you are. And so some different places to find me, my website, my email, and my phone.